Hello, I'm Dr. Danita Morales Ramos, but my beloved call me Dr. D. I am a clinical psychologist and I provide free information on mental health resources. So today I'm going to talk about psychoeducation. Many people think that a lot of mental health treatment requires you to be in therapy for an extended period of time, as well as needing lots of medication. And sometimes that may be the case, but that's not always the case. Oftentimes, mental health can be treated with something as simple as psychoeducation. So, what is psychoeducation? It's education about the mind, the way that the mind works. And so when clients come in to see me at my practice, Assert Yourself LLC, Mindset Coaching and Counseling, I provide first and foremost and throughout our time together education. Education on what mental health is and what it isn't, education on what mental health treatment is and what it isn't. And then I also provide education on different things that they may be experiencing. So, for example, oftentimes people come in and they may need a referral to a medical doctor to see if medication is appropriate. Oftentimes, those individuals may have a stigma regarding mental health that includes taking mental health medication. People believe that having a mental health disorder makes them weak somehow, makes them defective. So, what I explain to them is that mental health is no different from physical health in that it impacts your body just the same. It impacts one of the most important parts of your body, which is your brain. And so, how I create education for them and help them to understand how that works is I make an analogy of think about if your family member or you have diabetes or have high blood pressure or asthma. When you go and visit the doctor doesn't say to you or throw a pill at you and say, Here, take this medication, you're cured. What the doctor does, if it's appropriate, is prescribe some type of medication, like in the case of asthma, may prescribe an inhaler and then also give you some behavioral strategies in order to deal with that condition. Because as I know, there is no cure per se for asthma, but there is treatment for asthma. Okay, same thing with high blood pressure. As I know it, there's no cure for high blood pressure. However, there is treatment for it. And so your doctor may give you a medication to take in order to help control your blood pressure levels, but also tell you some behavioral things to do in order to control your blood pressure, such as changing your diet, losing weight, and exercising. Those may be some things, reducing stress. Okay, so with mental health, it's the same. If a person comes in and I diagnose them with major depression or post traumatic stress disorder or generalized anxiety or some other mental disorder, I don't prescribe medicine because I'm not a medical doctor. However, I do give prescriptions, if you will, for behavioral strategies, such as giving them some literature on their disorder, first and foremost, because I don't want them to go Google it. When you Google things, you can get information from anyone, and they may not be knowledgeable in that. Then I explain to them in layman's terms what that condition is. And then we talk about discovering how that disorder manifests itself in their lives. Because although 10 people may have major depressive disorder or generalized anxiety or PTSD. They may all experience it in different ways. So, providing that education about what their triggers are or what their symptoms are so that they recognize them early on so that they can begin to do certain things in order to not cure the disorder, but reduce the frequency that they experience symptoms as well as the intensity. So, psychoeducation is very, very important. It's also important to provide psychoeducation to family members or others that are in the patient's support system, as those individuals are the ones that help them outside of our session each week. to be able to implement those things into their lives. So, for example, if I provide treatment to a child for ADHD and I give the child some strategies on how to maintain their focus and how to reduce hyperactivity, you have a 7 or 8 or 9 or 10-year-old child, to expect them to be able to implement that on their own is unrealistic. So you incorporate their parents into family therapy and educate their parents on the same skills and how to help the parent to reinforce those skills so that the client can feel better, have a better quality of life. So today, I hope you have a better understanding of mental health, specifically about psychoeducation. If you want to know more about the services that I offer here at Assert Yourself LLC Mindset Coaching and Counseling, please visit my website at www.assertyourself.com. Please like and subscribe to my channel.